Appendicitis can be a potentially serious problem that usually the abdominal pain is on the right side and towards the umbilicus. And this needs prompt medical attention as it could lead to serious complications. Hi, I'm Dr. Abraham Neduvamkunnil. I'm a pediatric consultant working in Nottingham and Leicester. Today we're going to talk about the abdominal pain in children. Abdominal pain in children is a common condition and a frequent cause of visit to the doctor. And this could vary from a mild discomfort to more potentially serious underlying problems. It is therefore important to understand the common causes of abdominal pain in children. What are these causes? We know that gastroenteritis, which is a stomach bug, is one of the common causes of abdominal pain in children. This is usually accompanied by diarrhea, vomiting, and sometimes with fever. Viruses predominantly cause gastroenteritis in children, but sometimes there could be bacterial infections and occasionally other causes that can lead to diarrhea. The other causes are constipation, which is a lack of a regular bowel movement, which can lead to discomfort or cramping pain in children. The common ones in the older children could be because of just mere indigestion or eating too much of spicy food or rich food, which can cause abdominal discomfort. Appendicitis can be a potentially serious problem that usually the abdominal pain is on the right side and towards the umbilicus. And this needs prompt medical attention as it could lead to serious complications. People also wonder around food allergies or intolerances. And yes, it could cause like gluten in certain foods or dairy or other foods can cause abdominal pain in children. Increasingly, we are seeing stress and anxiety in children can manifest as abdominal pain, and that's why it is important to have a good assessment. Now, when should you seek a medical attention for children with abdominal pain? A vast majority of children will have non-specific abdominal pain, and it is harmless and it should resolve by its own. However, if your abdominal pain is persistent or severe, and then it is important that they seek medical advice. If the abdominal pain is associated with fever, vomiting, blood in the stools, or not passing urine or difficulty passing urine, this could indicate that may be a more potential underlying cause. Sometimes children are not able to pass a bowel movement or their associated vomitings, and it could suggest some serious pathology like obstruction. Unexplained weight loss in children with abdominal pain needs to be seen by a healthcare professional as a priority. How do you work up to diagnose the cause of abdominal pain in children? It is really essential that when a child has got a persistent or a chronic abdominal pain, it needs to be assessed and have a good physical examination and a thorough history. Sometimes doctors would advise you to get some investigations done, which are associated with certain types of abdominal pain that might be associated with blood or mucus in the stools, a stool sample to identify any infection or parasites. Blood test to check for any markers of infection or inflammation. And in the rare situation, you might need an ultrasound to look at your appendix or your gallbladder. X-rays and CT scans in the rarest of cases may also be required.